You wake up. The light peeks through the curtains, but before you even sit up, it starts the stiffness, that familiar tightness creeping through your knees. You swing your legs to the floor, press your hands down on the mattress, and push yourself up slowly. Your joints crack. You pause, breathe, then you move forward, telling yourself what you always do, it's just age, but deep down, you wonder why is it getting worse? Why, even when you're careful, taking your medications, eating well, trying to stay active, does the pain keep showing up like an unwanted shadow? Most people over 60 believe this is just part of life, and so they accept it. They swallow their pills every morning like clockwork, especially those small, seemingly harmless ones for pain or inflammation. Doctors prescribed them. Pharmacists filled them. You've trusted them for years. But here's the part that no one told you. What if the very thing you're relying on to feel better is slowly breaking you down from the inside? You see, your joints are complex, living structures. They're not just bones, they're full of delicate cartilage, fluid-filled sacs, and connective tissue that keep everything smooth and quiet as you move. But some medications, particularly the ones given to older adults for inflammation or pain, don't just dull discomfort. They also interfere with how your body protects those joints. One class of drugs, known as NSAIDs, is found in many common over-the-counter and prescription medications. These pills are designed to reduce inflammation, yes, but they also reduce the production of protective enzymes and joint lubricating fluids. Over time, what was meant to be relief becomes erosion. You don't feel it immediately. It's not like breaking a bone. It's gradual, slow, invisible, until one day your knees grind when you walk. Your hips feel like they've turned to stone. You find yourself avoiding stairs, sitting more, moving less, and yet you still take the pill because no one warned you. Because the pain returns when you stop. Because aging is confusing and you were never told there might be another way. Imagine this, waking up tomorrow and not feeling that deep ache. Walking through your kitchen without leaning on the counter. Going for a short walk without calculating every step. That kind of life isn't just reserved for the lucky. It's for the informed. It's for those who decide to question what they've been told is normal, because pain, real pain, isn't just a number tied to your age. It's a message, and your body has been trying to speak to you for a long time. You were never meant to live like this. You were never meant to trade mobility for a handful of pills. But now you know, the silent war happening inside your joints may not be aging, it may be a reaction, a warning, a call for change. And the first step toward healing is realizing that sometimes what feels like help is quietly doing harm. But before we continue with the video, leave a comment telling us where you're watching from and what time it is there. And share your story, because I, or maybe someone else, might be able to help you with your pain. You open your medicine cabinet. There it is, lined up neatly, waiting like always. That little orange bottle, the one with the white label and your name typed on the front. You've taken it so many times, you don't even think about it anymore. It's just part of the routine. Morning coffee, light breakfast, and then pop, the pill goes down. But inside that capsule hides something few seniors are ever warned about, a long-term effect that quietly chips away at your joints while pretending to protect them. This isn't a conspiracy. It's a misunderstanding, one that's been allowed to grow because no one wants to question what seems to work. Anti-inflammatory drugs, especially NSAIDs like ibuprofen, naproxen, and even prescription strength versions, were designed for short-term pain. They reduce swelling, they block pain signals. But what they also do is block a critical enzyme called COX-2, which, yes, causes inflammation but also plays a role in your body's ability to repair cartilage and maintain the synovial fluid that lubricates your joints. When you're 25 or 30, your body compensates. But after 60, it doesn't bounce back the same way. Your cartilage thins. Your synovial fluid becomes less viscous. And when you combine that natural decline with daily chemical suppression from these drugs, the result is a slow starvation of your joints. They dry out, they grind, they erode, until one day your knees buckle unexpectedly. Your hip locks when you try to tie your shoe. You fall not because you're clumsy, but because your joint has become a brittle hinge. And here's the cruel irony: when that happens, what's the first thing you reach for? Another pill. More of the same. It's a trap, and not because of malice, but because of habit. We're taught to treat pain with quick relief. We're rarely taught to look for the cause underneath it all. And so the cycle continues. More discomfort leads to more medication. More medication leads to more joint damage, and slowly you lose what mattered most: movement, independence, freedom. Think about this. How many seniors have been diagnosed with age-related arthritis that was actually accelerated by years of taking the wrong medications for too long? How many people ended up needing knee replacements, not because their bodies failed them, but because no one told them what was truly inside that bottle? You may be one of them, or maybe you're right on the edge. But you have something most people don't: the truth. And truth, when heard in time, can stop the damage before it gets worse. Picture your joints as living, breathing mechanisms like finely tuned instruments. Every time you take something that numbs the pain without healing the cause, it's like pouring water on a short circuit. It stops the sparks, but the wire keeps burning inside. Eventually, something gives, but here's the shift: you can step out of the trap. You can break the cycle, and it starts not by throwing your pills away, but by understanding their role, their risks, and the better options that are finally becoming known. You don't have to fear your medicine cabinet, but you do need to look inside it with open eyes, because behind that label, behind the routine, might be the very thing keeping you in pain. You take it because it helps. That's what you tell yourself. After all, your doctor prescribed it. The pain eases. The swelling goes down. You can move better, at least for a while. But here's the paradox no one wants to admit: the very pill you rely on for relief could be the same one quietly accelerating your decline. It doesn't happen overnight. That's what makes it so dangerous. You feel a little better today, maybe even tomorrow, but deep within your knees, your hips, your spine, a different story is being written. NSAIDs, corticosteroids, and other long-term medications work like silent messengers. They don't just lower inflammation, they mute the signals. They make your body ignore the damage happening in real time. And when your body stops noticing, it stops repairing. Your joints aren't just hinges. They're alive, woven with tissue, cartilage, and microscopic fluid systems designed to cushion your every step. When inflammation happens, it's not always a bad thing. It's your body's way of sending repair crews to a site of damage. But what happens when you silence the alarm every day? It's like taping over a check engine light and pretending the car is fine. You keep driving. Everything seems okay. Until one day, snap, the system fails. Let's be clear, not all medications are harmful. But long-term, unmonitored use of anti-inflammatory drugs in seniors is now being recognized by medical researchers as a serious risk. Some studies show that chronic NSAID use may not only damage joint cartilage, but also reduce the body's ability to produce proteoglycans, vital components of healthy, shock-absorbing joints, and that damage compounds. Every walk around the block, every trip to the grocery store becomes slightly harder. You start avoiding hills, then stairs, then standing too long, not because you've given up, but because something inside you is quietly giving out. What's worse? Many seniors think they're doing everything right. They stay active, they try to eat healthy, they follow instructions. But no one told them the full story. No one warned them that a pill created for temporary relief could become a long-term thief. This is the paradox. You take something to feel better and end up worse, but this isn't about fear. It's about awareness, because there is a way out. And it starts by asking the question most people never do: what is this pill actually doing to me over time? Some doctors now encourage their older patients to switch to joint supportive protocols, adding nutrients like glucosamine and chondroitin, increasing omega-3 intake, focusing on physical therapy instead of pain-masking pills. Others suggest rotating medications or introducing plant-based anti-inflammatories like turmeric or boswellia, which carry fewer long-term risks to cartilage. The truth is, your joints are desperate for protection, not silence. They want to heal, not hide. But healing only begins when you stop treating the symptom and start supporting the source. So tomorrow, when you hold that pill between your fingers, don't just swallow it with routine. Think about what it's doing beyond the pain. Think about what your body is still capable of if only you stop interrupting. It's natural healing. Your body hasn't given up on you. It's waiting for you to stop pushing it down and finally give it what it needs. You don't notice it all at once. It starts quietly, like a whisper in your bones. Maybe it's that brief hesitation when you rise from a chair. Maybe it's the slight grimace you make when stepping into the shower, the cold tiles meeting, a joint that no longer bends like it used to. You tell yourself it's normal, that it's just stiffness, just aging. But deep inside, there's a part of you that wonders why simple movements have started to feel like effort. You walk a little slower than you used to, not because you're tired, but because your knees no longer trust the ground. You take one step at a time on the stairs, your hand always grazing the railing just in case. You pause before sitting down, not out of caution, but because your body needs a moment to find the right angle. It's subtle. It doesn't scream, but it speaks every day in discomfort, and yet you keep going. You keep taking that pill because it worked once, because it was easier to believe it would keep working forever than to ask what it might be doing behind the scenes. You think the pain is inevitable, but it's not. It's a response, a reaction to something deeper, a message your joints are sending, hoping you'll listen. It's easy to ignore at first. A little stiffness in the morning, a creak in the hip that goes away after walking for a bit, but slowly, those moments last longer. They creep into the afternoon, the evening. They start dictating your decisions. You choose the shorter route, the chair with the armrest, the parking space closer to the door. Not because you're lazy, but because something inside doesn't feel stable anymore. That's the risk no one talks about, not just the risk of damage, but the risk of adapting to it, of reshaping your life around the limitations that shouldn't have been there in the first place. You lose mobility in inches, in habits, in small compromises that add up over time, and all the while, your body is trying to get your attention. It doesn't take a diagnosis to know when something is wrong. Your body tells the truth before the test results do. And if you've been relying on daily medication to get through the day, if you've felt that gradual decline in motion, in strength, in trust, then you're already seeing the signs. They're written in the way you sit down more carefully now, in the way your legs take longer to respond when you stand, in the way your world slowly shrinks around what your joints can handle. But that truth isn't meant to shame you. It's meant to wake you, to pull you out of the pattern before it becomes a prison. Because what feels like aging might actually be accumulation. Not of years, but of wear, of friction, of neglect wrapped in routine. You are not fragile. You are not finished. You are simply overdue for a new kind of care, one that listens to the quiet pain before it becomes loud. Because recognizing the risk is not the end of the road. It's the beginning of taking it back. The most painful truth is the one you were never given the chance to hear. For decades, medical science has quietly uncovered the mechanisms behind joint decay, inflammation, and mobility loss in older adults, but that knowledge hasn't always made its way to the people who need it most. People like you. People who trusted their doctors, followed the labels, and believed that what came in a bottle was designed to heal, not harm. You were never told that certain anti-inflammatory drugs, when taken continuously, can interrupt your body's natural joint repair process. You were never told that inside each of your joints are cells, tiny, resilient builders called chondrocytes, responsible for producing and maintaining the cartilage that cushions your bones. These cells are your silent guardians. But medications, like NSAIDs and corticosteroids, over time can suppress their activity. Instead of helping your body recover, they shut down the workers keeping your joints alive. You were also never told that your joints are lubricated by something called synovial fluid, a slick, egg-white-like substance that coats every surface where bone meets bone. It keeps movement silent and smooth. But research now shows that prolonged use of certain medications can dry out this fluid. Not all at once, not overnight, but little by little, day by day, until your joints begin to operate like an engine without oil, and when that happens, the damage becomes irreversible. That's why, today, some of the most forward-thinking doctors and researchers are sounding the alarm, not because these medications are inherently evil, but because they were never meant to be used this way. Not every day, not forever, especially not in a body over 60, where regeneration slows and every interruption carries more weight. Scientific journals have quietly published these findings. University labs have measured the cartilage loss, documented the enzyme imbalances, and warned of the long-term risks. But this information rarely makes it into the conversation at your local clinic. It doesn't fit in a 15-minute appointment. It's not printed on the side of the pill bottle. So you're left in the dark, taking the same pill every morning, believing it's helping while inside, your joints are starving for what the medication has taken away. But it doesn't have to stay this way. Knowledge, once received, can't be ignored. You now understand what's happening. You now see the process for what it is: not a mystery of aging, but a predictable outcome of chemical suppression. You know why your body has been moving differently, feeling heavier, less fluid, more fragile, and you're not alone. Studies show that up to 70% of adults over 60 are currently taking medications that may negatively affect joint health, yet only a fraction have been advised on safer, restorative alternatives. Alternatives that support your body's repair systems. Instead of disrupting them, imagine what your body could do if it weren't constantly fighting both age and interference. Imagine if your joints were nourished instead of silenced. If your cartilage could rebuild, your fluids return, your movements become light again. This isn't a fantasy, it's biology, waiting to be supported instead of suppressed. Your body was designed to move, designed to heal, but it can't do either when it's being chemically told to stay quiet. It's time to listen to the science that was buried. It's time to give your body back the voice it lost. You've heard enough to know something has to change. Not because of fear, but because you finally see the truth. And the truth has power. You don't need to live in pain. You don't need to accept slow decline as your future. What you need now is action. Simple, safe, daily choices that don't just cover the pain but help your body restore what's been lost. IT starts with understanding that your joints are not broken, they're neglected. And what has been neglected can often be rebuilt slowly but surely if you stop feeding the distraction and start supporting the repair. That doesn't mean throwing away your medications today. It means learning to balance them, to complement what they do with what your body truly needs: nourishment, movement, circulation, hydration, and protection. One of the most powerful shifts you can make is in what you put on your plate. Science-backed nutrients like omega-3 fatty acids found in fish like salmon or supplements like krill oil have been shown to reduce inflammation without blocking your body's natural healing response. Turmeric, when taken in therapeutic doses with black pepper, can rival over-the-counter anti-inflammatories without the cartilage-damaging side effects. Ginger, boswellia, vitamin D, and magnesium all support bone strength and joint mobility in ways that medications can't. But nutrition is only one pillar. Your joints thrive on movement. Not heavy, punishing exercise, but consistent, gentle motion. Walking, stretching, light resistance training, even just rotating your ankles while seated keeps blood flowing into the joint capsule, bringing oxygen and removing waste. Every movement is a message to your body: this part is still alive. Keep repairing it. Hydration plays its own quiet role. Synovial fluid, the cushion between your bones, is over 90% water. If you're not drinking enough throughout the day, you're starving your joints of their most basic defense. It's not about guzzling gallons, but about consistent, steady intake, especially in the first hours of the day when your body is most dehydrated from sleep. Then there are small habits often overlooked that make a big difference. Wearing supportive shoes, especially indoors. Avoiding long hours sitting without standing or stretching. Using heat therapy in the mornings to loosen stiff joints. These aren't gimmicks, they're simple rituals that realign your day with what your body actually needs to function. And above all, the greatest change happens when you shift your mindset from passive maintenance to active restoration. When you stop asking, "How can I manage the pain today?" and instead ask, "How can I support my body's ability to heal?" That question leads to a different life, one with fewer pills, one with more control. One where you wake up not fearing the first step, but trusting it. Now, take a moment. Close your eyes, not in fear, not in frustration, but in reflection. Picture yourself waking up tomorrow morning. The light slips through the window. You shift in bed, sit up slowly, but something feels different. There's no tightness gripping your knees. No hesitation as your feet touch the ground. Your body moves not perfectly, not like it did when you were 20, but smoothly, confidently, without pain. You stand with ease, you breathe deeper, and for the first time in a long time, you don't brace yourself for that familiar discomfort. That moment is possible because healing doesn't always arrive with noise or fanfare. Sometimes it comes softly in small choices, steady routines, quiet determination. It comes when you replace what harms with what heals, when you give your body time and nourishment instead of chemicals that silence its signals. It comes when you start believing that strength, vitality, and clarity aren't things you've lost, they're things waiting to be reclaimed. Your body is not your enemy. It's not broken. It's not weak. It has simply been trying to speak to you through pain, hoping you'd one day pause and listen. And now you have. You know now that not all pain is natural. that not all prescriptions bring restoration, and that the pills you once trusted may have silently pulled you away from the mobility, joy, and confidence you deserve. But today marks a turning point, because today you understand that real healing comes not from masking symptoms, but from nourishing the source, from moving with intention, from eating with purpose, from treating your joints not as fragile but as sacred. So, give yourself permission to change, not through extremes, not with urgency, but with patience and presence. Step by step, sip by sip, breath by breath, your body will remember what it means to feel whole again. And when that day comes, when you rise from your chair, climb those stairs, or walk through the park with ease, you'll realize the most powerful medicine was never in the bottle. It was always in you. If this message touched you, share it with someone you love. Sometimes what saves a life is a single warning whispered at the right time.